So this presentation was created for parents, teachers, and other school professionals. I'm going to turn off my video so that I can go through the screens without this on my presentation. Okay, so first we're going to go over some of the basics. How is stuttering characterized? What is it? So stuttering is considered a speech and neurological disorder associated with different brain functioning and timing cues between our brain hemispheres. These timing cues can cause speech disturbances characterized by repetitions of sounds, syllables, or words, prolongations of sounds, and interruptions in our speech and airflow, known as blocks. So stuttering is common in childhood, affecting about 5 to 8% of children at some point. Stuttering usually resolves on its own, but around 1% persists into adulthood. Approximately 3 million Americans stutter. And in adults, the male to female ratio is about 4 to 1. So a lot more males than females stutter. So why is it important to understand and identify stuttering at an early age? Well, because stuttering can have a significant impact on a child's social, emotional, and academic development. Early intervention and support is crucial to making a positive difference in the lives of people who stutter. So there's 3 main types of stuttering. The first one, which is the one we're going to be primarily talking about, is developmental stuttering. And this is the most common type. It usually begins around 2 to 4 years of age and is caused by a combination of genetic and environmental factors. Neurogenic stuttering, this is a type of stuttering that is caused by damage to the brain, such as from a stroke or head injury. Psychogenic stuttering, this type of stuttering is thought to be caused by more of a psychological factor, such as stress, anxiety, or trauma. So some of the signs of stuttering that can be seen are frequent repetition of sounds, syllables, or words, prolongations of sounds, blocks, which are silent hesitations and primarily look like they happen when someone loses airflow and cannot create voicing. So there's a lot of tension and a lack of airflow that happens. You can also see signs of stuttering by if a child or student is avoiding certain words or sounds. Again, if there's that visible tension or frustration or anxiety while speaking. And these can all come in a variety of forms, if it's a mild stutter, a moderate stutter, or a severe stutter. So we're going to do some myths and facts about stuttering. Stuttering is caused by nervousness or anxiety. While anxiety can sometimes exacerbate stuttering, it is not the root cause. Stuttering can be cured. Myth. There is no cure for stuttering. And generally, speech pathology is not a curative profession, but we help by giving effective therapy that can help manage fluency and confidence when speaking. People who stutter are less intelligent. Myth. Stuttering has no bearing on intelligence or cognitive ability. Ignoring stuttering will make it go away. Oof, myth. Ignoring stuttering can actually make it worse. Early intervention is key. So, how to support a child or student who stutters? We're going to go over this list and then we're going to go into a few of them in more depth. So, we of course want to be patient and understanding. We want to listen actively and make eye contact with that person. We don't want to interrupt or finish their sentences. We ourselves as speakers want to model slow, calm, and deliberate speaking styles. We want to provide opportunities for relaxed conversation. Avoid drawing attention to the stuttering in negative ways. Encourage the child to express themselves openly and honestly at all times, and celebrate their success and progress as it comes. So, what does a speech language pathologist do to help a child who stutters? First, we need to help them learn about communication as a whole and stuttering characteristics themselves so that there's an open book. We then work on reducing the frequency and severity of stuttering behaviors. We can help students learn techniques for enhancing or modifying their stutter so that it can happen in an easier way and a more controllable way. We also work on improving overall communication skills. We minimize negative reactions to stuttering, educate others in the environment, which is key, and generalize skills into a real-world setting to make things the most functional we can for our clients and students. So what can we do to help students feel more confident speaking in class? This is a question I've heard from a lot of teachers and one that I wanted to talk about and give some suggestions for. So we're going to begin with oral reading in class, something that we all go through and something that can be very traumatic for lots of people who stutter or people who have anxiety speaking. So the first thing that I'm going to say for oral reading or oral reports is that we need to begin a dialogue with the child support team, including the student themselves whenever possible, to identify the best way a teacher and student can handle classroom speaking situations. So here's a couple examples and suggestions. Again, this is going to be up to the student and the teacher themselves. So it's something that has to get worked out. So not all of these are going to work for everyone. Some kids would prefer random selection when oral reading. They might have increased levels of tension when they must sit and wait for their turn to talk. One way of decreasing this anticipation pressure is to select students at random rather than going in the order of the row of chairs, building that anticipation person to person. Some people may like that. It might give them more of an opportunity to prepare. Again, all depends on the kid. Lots will prefer the I'm first, I'm last, where they can prefer to choose their order so they don't feel growing amounts of anticipation. Teacher can plan to have a covert signal to indicate if they are ready to read aloud on that particular day or if they are not feeling comfortable speaking. Knowing that they have some control over when they will be required to speak can help decrease this level of anticipation and anxiety. Some communication pressures can be also reduced when more than one student shares responsibility for a discussion or presentation. This can help the student know that they will not be alone when they're trying to talk in front of others. And of course, we need to allow ourselves to be open for other creative opportunities that that student or that team might come up with. We're going to jump from oral speaking or oral reading to oral reports, something that a lot of kids are very unsettled by. Definitely popular in the stuttering community that oral reports are genuinely pretty strenuous. So these are some suggestions to try to help in that situation. So one thing that we can do is try to eliminate or extend time limits to minimize any kind of time pressure that we have. We can give them the option to give the oral report in a small group setting. We can let them choose the order of their oral report. We can give that oral report in a partnership with another student. We can allow the student to practice in an empty classroom before facing the class. And then on top of that, we could allow that student to practice in front of that class with a desired person or with a peer and slowly kind of build up their comfort up to speaking in front of a class. And in severe cases only, we would allow the student to complete a different type of assignment to demonstrate the child's knowledge of this subject matter. So these are some suggestions for time oral reading fluency assessments in the schools. So reading fluency is often assessed orally in school-age children through the collection of words correct per minute score. And in many cases, this can result in students being assessed using a scale that taps straight into their most difficult speaking task, speed and fluidity of speech. So teachers, parents, and SLPs can be advocates for children who stutter by recommending that they be exempt from the timed oral reading fluency sections of the assessment. Instead, these children can be offered alternative silent reading assessments, such as the test of silent work reading fluency or the test of silent contextual reading fluency. So these are some tips for teachers, but they're also just tips for anybody who comes in contact with a person who stutters, just kind of some overall arching suggestions. We are trying to not give simple suggestions to kids, such as slow down, take a breath, start over, think about what you're going to say. All those are very well meaning and seemingly helpful for children who struggle speaking. Unfortunately, those suggestions can actually become counterproductive by actually increasing unnecessary pressures and can actually make it harder for them to communicate or want to communicate. Again, we want kids communicating, and if they're stutterers, we want them stuttering. We want them communicating all the time. Another thing we want to keep in mind is that we don't want to finish the students' sentences. This is a difficult one. This is a difficult one for everybody because we all want to help. And if we see somebody struggling, we generally want to help. But in this situation, we want to wait patiently for them to finish speaking on their own terms. You can reflect back on what you've heard so that they know that you have understood them. Then you can give them an opportunity to repair the message if necessary. Completing their sentences can make them feel unheard and discourage them from trying to communicate with you or others. So we just want to be sure that we are trying to be patient, even in those times when we really have to act fast. You really got to reach down deep and try to be patient, understanding, and accepting of that student's stuttering. Avoid drawing attention to it or making negative comments, obviously, and be sure to think about and manage your own reactions. We want to maintain eye contact and we want to listen attentively. We're trying to be content-based listeners. Show the student that you're interested in what they have to say, not how they say it. We're going to try to reduce pressure and stress by providing opportunities for the student to speak in low pressure situations, such as one-to-one conversations or small group. We want to encourage turn taking. This can be done by implementing strategies like raising hands or using a talking stick to ensure that everybody has a chance to speak without interruptions. And we try not to rush students or adhere to unnecessary time pressures. So when a student who is feeling, or when a student who stutter is feeling the need to speak quickly, tension can build up in their speech muscles. They can have issues with their airflow, thereby increasing the likelihood of that stuttering behavior to happen. We want to model slow and relaxed speech. This is hard for a lot of people because we talk in a very fast-paced environment. But when we talk really fast, and when we're around other people who talk really fast, there's a physiological response that happens. If you're around someone who's talking faster, you end up talking a little bit faster. If you're around somebody who's talking more calm and slowly, you might then talk a little bit more calm and slowly. So it's something to remember. We speak deliberately, try to throw in some pauses and avoid rushing our words. Oh, excuse me. This can help a student feel more comfortable and able to take their time while speaking. Sharing resources with teachers, staff, students, parents, anything to help raise awareness and understanding of stuttering. This also includes, if the student is up for it, to have their own presentation about stuttering, just to show others in the class. A lot of us who work in rural areas will realize that there may only be 1 or 2 kids who stutter in an entire school. So there probably has to be some awareness that has to happen. And then if the kid is up to it over time, we should allow him to present. Oh, I'm so sorry, everybody. We also want to collaborate with the speech language pathologist. If the student is receiving speech therapy, work with that therapist to develop a consistent approach to support their stuttering in the classroom. And I think my throat is about to end, and it might be a good time to show my references. These are all sites that can help give, and they all share information to share with parents, teachers, and those who stutter. These are some other resources that have more information and will be included in the PowerPoint.